Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 41 new cases of COVID-19 in Windsor and Essex County. Of the 41 cases, 14 cases are close contacts of confirmed cases, 2 are community acquired, 1 is outbreak related, and 24 cases are still being investigated. We have had 14,195 cases since the beginning of the pandemic. 13,386 cases are now resolved, and 404 people are active at this time. There are 160 preliminary or confirmed variants identified in Windsor-Essex County. Between March 30th and April 5th, 18.9% of our cases were reported as variants of concern. 19 cases are currently in the hospital and 5 people are in ICU. I'm sorry to be reporting an additional 2 deaths today. Our community has now lost 405 people to COVID. A man in his 80s and a man in his 90s, both from the community, have passed away. There are currently 5 active outbreaks in Windsor and Essex County, 3 workplace outbreaks and 2 community outbreaks. A total of 105,133 doses of vaccine have been administered to Windsor-Essex County residents. 92,752 people have received at least 1 dose. Just to provide some coverage numbers, overall, adults 60 years and older, we have a 66.3% coverage rate. I'll just go through some of the age categories. Adults 80 years of age and older, we have an 87.6% coverage rate. 75 to 79 years is 79.9%. 70 to 74 years is 66.5%. 65 to 69 years is 41%. And 60 to 64 years of age is 55.1%. Our vaccination clinics are completely booked for appointments through till Monday, April the 12th, the end of the day. We are establishing pathways for those that are in prioritized groups to book, and will likely open up more spots tomorrow. Postal code neighborhoods have been prioritized, and they are beginning with the first 3 characters of your postal code of N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. So they have been identified as high priority areas in Windsor and Essex County, and we're working to make sure people 50 years of age and older have access to a vaccine. As appointments are added, you will be able to book at wevax.ca or by calling 226-773-2200. Please note that whether you book online or call, the appointment availability is the same. Selected pharmacies and primary care providers will be offering vaccinations as well, and more information will be shared as we receive further details. For general inquiries regarding the vaccination, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us today. I don't have much to add except for the part that you already are aware that the province has now officially announced that we are now into the phase 2 of the vaccine rollout, and as we continue to vaccinate our community, we are almost at the point of completing our phase 1 population. We have already been doing some of the earlier priorities of phase 2, but from this point onwards, we'll be working on the strategies to ensure that the phase 2 priority populations are covered. And as we continue to monitor the situation in our COVID transmission in our community, we'll make sure that everything that's happening with respect to the spread is contained and the vaccine rollout continues as we move forward. Thank you.
We'll now take questions from the media. Today we'll start with AMA 100.
Teresa or Dr. Ahmed, I'm not sure who wants to answer this, but yesterday there was the demonstration out front of a Leamington restaurant. We talked to the restaurant owner and she said the enforcement officers went there over the weekend, no tickets were issued. She did receive previous tickets, she did mention. Just wondering why tickets weren't issued over the weekend. She said health unit representatives will be coming back yesterday, and while I was there and other media were there, the health unit did not show up. Just wondering if the health unit did show up and if tickets were issued.
Well, Rob, as we have indicated before, we don't get into the details of who get ticketed unless we are they're charged. So we don't disclose the name of the specific businesses. So at this time, I cannot comment on that part. But all I can say is our inspectors and our enforcement officers follow up on all of these complaints, and appropriate actions are always taken. And when we are talking about this type of event, it does require a lot more discussion with our law enforcement partners. And the Reopening Ontario Act is primarily enforced by all the agencies involved, and we have had a good system of working together to get all of those things done. And especially in these type of situations, we need the law enforcement agencies to step up and do the rightful that's needed to ensure that the rule of law is followed and everyone is following what is under the legislation and what is in the Reopening Ontario Act.
I guess to that point, and that's where I'm getting a little confused here, she did tell us that she has been open since early February. The red zone didn't go into effect until February 16th. She did tell us officers have been on site. Our station reached out to the OEP yesterday and we got a response saying people have the right to protest peacefully. Our role is to keep the peace at this time. I guess my question is, if she's been open since early February, prior to the red zone, why hasn't she been shut down? In Toronto, when that one restaurant kept open, they changed the locks, officers were there, enforcement officers are there. I guess what's the difference here? And I think that's why the public is getting maybe questioning some of these methods.
I hear you, Rob, but I think I'm not the person to answer this question. You'll have to ask our law enforcement agencies to answer that question. We are public health. Our role is about the public health. The Reopening Ontario Act and all these requirement and restrictions that are put in place, especially when it comes to any kind of an indication that it would lead to more confrontation, those type of situation, our staff are not trained or equipped to deal with all of those things. When we are finding that this is the violation, we can issue a ticket, we can put some of these businesses and violation under our orders, but at the end of the day, it's about law. It's about ensuring that the law is being followed, which is not something that we can enforce, and we have to rely on our law enforcement agencies. So I would ask you to redirect your question to them to better get the answer, because we don't have that type of enforcement powers or authority to go in and take these type of action. It has to be the law enforcement agencies who can do that.
Can the health unit, I guess, reach out to officers and ask them to make that move, or basically with the provincial police, since it's Leamington, would have to make that decision on their own?
Well, it is in the law. They don't need us to do anything. The law, whatever in the Reopening Ontario Act, can be implemented by the police, by the bylaw officers, and whatever comes under public health, we do that as well. So it's a good, strong working collaboration with all our partners, and we've been doing that for a long time. So they don't need our approval or our support. If they find anyone in violation, they can go ahead and do that. The conversation, as you're asking, yes, it did happen, and it continues to happen, to come up with a better strategy to make sure that we are not creating more problems by solving one problem. So I think those conversation is ongoing. But at the end of the day, the enforcement piece rests with the law enforcement agencies.
Sorry, one final one here. Are you worried that, and I kind of asked you this question last week, are you worried that maybe more businesses see this and they'll open up?
Well, absolutely. I think it's unfair for everyone to see that, I voluntarily shut down and then the others are blatantly violating what is under the requirement. So I think it does affect everyone in the community. And at the end of the day, I get it. And I think most people get it, that there is a lot of impact that this pandemic has put into, maybe some people more than the others, but everyone, each one of us have been impacted by pandemic in one way or the other. And all these measures that are put in place, it is there to protect everyone, to protect the community. And anyone violating those orders, it does put the entire community at risk. And we definitely don't want that, especially when it is a clear violation, when it is a clearly defiance of something that's been already told. We have worked with all our businesses, all our partners, in terms of providing them with the guidance. Sometimes there is confusion, sometimes there are gray areas, so we help them understand that. But despite all of that, if it continues to become a problem, then we as a community have a problem that we need to address, and we need to make sure that these laws are followed and we are doing everything to keep our community safe.
Thanks, Dr. Amish.
Any questions from CTV?
Yes, good morning. Just looking for a little bit more clarification and update on the vaccine booking. Appointments are going unfilled in other regions, but that doesn't seem to be a problem here at all. What is the situation like? Are people having problems booking? Are any of the appointments being unfilled, or?
We don't have that problem here. We have all of the appointments that have been available are booked right now till the end of day, April 12th. We are talking internally about actually adding some additional, stations, or not stations, but appointments to increase our capacity a little bit. But we do also, the age group, and the ministry the province is joining today with moving the age group to 60 plus. So we're all aligned with the age group, but we're also doing other groups concurrently. And so we want to make sure that when we do open up areas or appointments, that we are able to support other groups that are being prioritized. So I did talk about the FSA, or these postal code neighborhoods. People over the 50 years and older would be eligible for a vaccine as well. And we'll be working more closely with making sure that people prioritized in those neighborhoods have access to the vaccine and can book as well. So it'll be either a call-in, also verification by postal code and address on the online booking. So we're working out the logistics of that as well. So it's not a matter of not having enough availability. All of our spots in the mass vaccination sites are being filled.
And you gave a breakdown of the age groups and the vaccination rates. Are you satisfied with how many people have been vaccinated in each age group so far?
Well, we know that there are about 71,000 people over the age of 60 that have been vaccinated in Windsor and Essex counties. So I think it's a great start. I think there are some age groups that can be improved upon as we have more access to vaccine. I'm just looking at it right now, but it is pretty a pretty good start. And above all of these percentages, we're pretty, we're doing really well. I'm looking at the lowest group would be 65 to 69, 41% are vaccinated at this time, so that would be the lowest group. So maybe a boost in that group would be warranted. And 60 to 64, as you know, we had a good head start with the pharmacies. We know that there will be additional access with pharmacies and other primary care providers. So I expect that these age groups will increase some more as well.
Great, thank you. Now, Dr. Ahmed, a few weeks ago, the region was almost in the orange zone, and now probably we're facing more restrictions with the province expected to announce a stay-at-home order. Do you think that a stay-at-home order is too harsh for this region?
Well, I think what we are seeing is an increase in the case rates everywhere. And we have also started to see some increase in our community as well. And we know when early actions are taken, it prevents a long-term impact. And if we delay taking the action, it would have a much bigger and a worse impact in our community. So I think as if we just look at what today's numbers are, then yes, someone would argue that it may be harsh for our region, but with the trend where we are heading, it can get worse. So I think that's the critical point. The other point is when the measures are taken in one place and not the others, it just brings other people from other regions to that region, and then further contributes to the spread of the disease. So it's a little bit much more complicated relationship when we are doing something in isolation versus something doing together. And from a bigger picture perspective, a strong measure earlier on with every places that are involved, I think that helps to contain the spread much quicker than the patchwork of containing one here and leaving the others out and then working on something else. These type of measures, as harsh as it sounds, but it has shown to show the effect. Where we were in December and January with the stronger measure that were put in place, it helped to decrease the case rates. And we are heading in that direction with what we are seeing in the larger cities. It's possible that we end up in the same situation, and we definitely don't want to be there. We don't want to lose any more lives. We don't want to see people dying. We don't want to see ICUs filled with COVID patients. We have seen it all, and we definitely don't want to see it again. So hoping that with whatever measures that will be in place, it will help to improve the health of our community and prevent further death and hospitalization in our region.
All right, thank you.
Any questions from CBC?
Hi, yes, good morning. Doctor, today on Windsor Morning, you mentioned that the health unit is looking at strategies to vaccinate those in the temporary foreign worker community. Are you able to share more details about where the planning is with that and when we might possibly see those vaccinations roll out?
So I'll start and then I'll pass it on to Teresa to share additional details. So obviously we know that we have close to 180 farms in our region, and it does require some discussion. We need to get them prepared for their workers to identify a spot for them to get vaccinated, whether it's a central location or whether we want to do it a piecemeal, whether we just want to dedicate a clinic for them. So that's the kind of work that's been already happening. We have started that work about a week ago, and we still have to work on some of these kinks, and also to make sure that we have enough vaccine to vaccinate them alongside with some of the other priorities. So that work is ongoing, and I'll pass it on to Teresa to maybe share some additional details, because there's a lot of work that's been happening right now.
So we have been working with the farms as well. Our public health inspectors inspect the bunkhouses, so they have been providing information as well. Erie Shores Healthcare has been working with farms as well to talk about vaccination strategies and to support vaccine and address any issues. We are launching our website specifically, a webpage specifically for the farm operators and farm workers, and it has lots of information. We did a review of it yesterday, and in multiple languages, so people would be able to access it and get not only information that's translated into Spanish or other languages, but also there are some videos there explaining the vaccine, the what you can expect. So all that preparatory work has been going on, and as we talk about the impacts of the vaccine, we know that it has really been effective in long-term care homes and retirement homes, and we know that from last year, the temporary foreign workers and many of the farms experienced severe outbreaks and significant impacts to their workers. So to vaccinate the workers is very much not only on our radar, but it's in our plans, and it will happen in the next couple of weeks. It'll start.
Okay, thank you. I also was hoping that you could get into a little bit more detail about the postal codes that were selected for vaccination. Was there any kind of threshold that you used for case rates, or I know you were also looking at social determinants of health. Any I guess criteria that you used, or any way you could elaborate on postal codes were selected?
So I'll start, and if Dr. Ahmed has anything to offer. So these are provided to us through the province and through different indicators and metrics that they've used. But it's consistent with what we see locally and what we have prioritized in other strategies, even for testing and now for vaccination. So it is, two of the postal codes are in the Kingsville and Leamington area. So we do know that it's probably linked quite heavily to the impacts of farm workers. So, that's something that has always been on our radar. The other postal codes are typically in the, I'm trying to figure out the map, but we're going to add more information on our website and a map, but they're typically in the downtown area toward the river, a little on the west end. So we, as you know, we do have a downtown vaccination clinic that is being run by Windsor Regional Hospital. They're right in the heart of, some of these neighborhoods. And so access to a vaccine is doable. And we want to just make sure we support that. So, we'll do our best to make sure people that are able to get vaccinated, are aware that they're eligible and that it's 50 years and up, and that based on this prioritized group through the province and supported locally, that they are eligible, and we'd want them to make sure that they take advantage of that access.
Any questions from Blackburn?
Yes, just further to Teresa. So once you open up more appointments past Monday, those populations in those postal codes, there'll be a way for them to register themselves. Is that, I just want to clarify that.
So we'll probably have a method of where they can call in, and they'll have to give information about their postal code, and then again asking for confirmation at the site. We don't want to create a barrier, but we do want to confirm that those that are eligible are really being vaccinated, and there will be the ability for people to register online and book their appointment online. And we'll the other thing to know about vaccinations right now is that the City of Windsor have offered free transportation through the Transit Windsor to the vaccination site. So that's also available as well. So we want people to identify any barriers they're having to getting to a site and making sure that we help them, and bring them to a site and make sure there's access for them. As well, we are still working with primary care providers and pharmacies. So people will have access through different, through different means, and we just want them to take advantage of it.
And just further to the announcement yesterday about phase 2 and the different groups that were available, or that will be, eligible for the vaccine, just so that people are completely clear, I guess. They're still working with the primary care providers for those people that are at risk or high risk. They'll still be determined by their primary care provider. They won't be able to self-identify as at risk and register for a vaccine.
So the process right now has been to work through the Essex County Medical Society with key people to send out communications to physicians and nurse practitioners and ask them to identify people in the highest risk and the high risk categories for medical conditions. And then through a referral type process, they get brought forward and are notified that they can come for an appointment at a clinic. In the phase 2 documents, they are saying that people in the high risk would be able to go to their family physician for vaccination. This isn't the case in, across Windsor and Essex County because we have limited vaccine and right now limited primary care providers providing the vaccine. But any of those that are, and in the family health teams and other physicians that will be onboarded, they will have that ability to vaccinate along with the age prioritization, 60 and over, and then also through the medical conditions as outlined in the document. So we have made good progress. When I say we, again, I have to thank our partners at Windsor Regional Hospital because we have collaboratively been working together to develop this system where there's a referral. Not perfect. We are finding out that people are being missed, but we ask that, they refer to the letter that was sent to the physicians and, forward information per that method right now. And I know Dr. Ahmed has been thinking about, what further strategies we need to do to make sure people aren't missing this opportunity. It's very defined, though. It's not everybody that's at high risk. It's very defined on the medical conditions.
I guess I'm just curious, you see a lot of talk online, like, well, they identify as one of those lists that are listed in that document. If they feel that they are, should they be contacting their primary care provider to make sure that they have been referred? I mean, I've also heard of, individuals being referred and they're not really even aware why they were referred for an appointment. So it kind of seems it's kind of on both ends. What advice would you give somebody if they think that they have a medical condition that is on that list provided by the province?
Yes, so we definitely would ask that they get in touch with their primary care provider because the people that are on the list as high risk or highest risk populations, if they're not aware, they should definitely be talking to their primary care providers. So that would be the best, avenue for people. And that's what we would recommend.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Also included on the list are the essential caregivers for all of the people listed with those high-risk health conditions, the specific ones. Is there any plan in place to get those individuals vaccinated, or should they follow the same avenue and communicate through healthcare providers?
So just to clarify that on the list of the highest risk priority, in that document, that it's one essential caregiver for people that are in the highest risk medical condition is what is identified. So I know that as we had moved forward, because we were a little bit ahead, that we have not done that. So we'll have to figure out another strategy to get the essential caregiver. But it was very specific to those in the highest risk populations. I haven't seen the caregiver listed in the other populations. So the highest risk populations, and I'm looking at the document, but it's, organ transplant recipients, kidney disease. These are very defined medical conditions and not across all of the other ones that are at high risk or at risk populations that are more inclusive of other diseases. They don't mention caregivers unless I'm mistaken or something changes, but at this time it was for that highest risk.
And also included in that phase 2 document, or the news release at least put out by the province yesterday, are people who live and work in some congregate settings and certain people who can't work from home, like teachers, as we've been discussing for some time now. Do you perceive that the vaccinations of those groups, particularly the essential workers, might be a bit too far off to be thinking about the specific logistical plans to vaccinate them right now?
I think we're thinking about the logistics, knowing that we still have a very limited vaccine in our community, and I've talked about it, pretty much every day that we're not really seeing an increase in vaccines at this time until we don't into the middle of May now. The supply is basically the same. So it's balancing the age groups as well, which we know we're making good progress. And then these other prioritized groups, and you're correct, there are congregate settings, and we do have mobile teams and working with Essex Windsor EMS to vaccinate certain at-risk or higher risk congregate settings that are, and some of them are in the identified postal codes. So we are working on that as well. So we're all taking from the same amount, from the same pool of vaccines. So the prioritization within phase 2 is also key, but I think you will see some movement in different groups, and it will, it will roll out as best we can. It won't satisfy everybody because you've seen the essential workers that cannot work from home, and there's two different categories in the first group, the second group, but they're all important, and that's where it gets a little difficult when there's still the same amount of vaccine and everyone is concerned. And I hope that in Windsor and Essex County, that the uptake of the vaccine when it's available to them is that they actually take it. And so with pharmacies and primary care providers and the mass vaccination clinics, hopefully there's access, but the overall vaccine is still limited.
With the supply the region is receiving right now, is it reasonable to expect that we will be completed the vaccination for everybody who wants one by the end of summer, which is the federal government's target?
First doses, and I believe that that's something that we've all been working for. I think we will need more vaccine, and so Dr. Ahmed and myself, we've been advocating for, participating in the pilot projects has been great for our area because it gives you access to other vaccine. We keep advocating for, more vaccine for different groups. But, I think hopefully we'll get more vaccine come, toward the end of May and into June, and be able to vaccinate and accomplish that goal of having everyone done with first doses. But right now with the rollout of maybe 14,000 doses every week, I think we have a long way to go. But, and we also will, based on our numbers and the initiation of the first doses, we will have to begin second doses the end of June, that last week in June. So that also takes away from your vaccine supply. So we will need an increased supply, because you'll still be doing first doses and then second doses. So we'll see where it goes, but we're doing our best for sure.
Thank you.
Any additional questions from AMA 100?
Teresa, just in regards to the vaccine, do we get vaccine weekly, or how often do we get the vaccine shipped to Windsor-Essex?
So Pfizer is, there's a shipment weekly when things are running smoothly, and Moderna not so regular. So we get Moderna, it's supposed to be, every couple weeks, but I'd say that it's not been consistent. And you may have recalled that we had a shipment or a supply, and then we were told that it'd have to be a split. We'd get some on this day, some on another day. So Moderna's less predictable, but the Pfizer vaccine has been more reliable, and we do get that. And we have conversations with Windsor Regional Hospital almost every day to make sure that we're looking at where the vaccine's going, how much we have, what has been received. But everything that we have has come into our area is either already administered or already spoken for. So as you know, as we talk about booking, 1,000 or not 1,000, but booking into next week, though that vaccine's there, like it's spoken for. It's not all being administered today, but it's all spoken for. And we continue to use all the vaccine that we have. We have very little that we hold back, but we're being very responsible and accountable for the vaccine that we get and moving it out as quickly as we can through all these different avenues.
Is the province jumping the gun with their phase 2 plan if regions like ours is not getting that vaccine we need?
I don't know if they're jumping the gun. I think I can't really speak for the province. I know that we'll use whatever vaccine we're given, and we keep advocating for more. And there will likely be more. There'll be more AstraZeneca. We know that once Johnson & Johnson releases their vaccine, that's another, that would be a fourth vaccine to our area. Right now, primarily though, we're using Pfizer and Moderna, and then the AstraZeneca, as you know, really helped with the pharmacy rollout. So I think there'll be more opportunities for vaccine, but right now, like today, we are using everything that we have been given to us. And, it does help to be able to do other groups other than age groups, because as you know, there are areas at risk in Windsor and Essex County, and vaccinating them will prevent serious death, serious illness, hospitalizations and death, and that's our goal with the vaccinations.
Thanks, Teresa. And I was on the call yesterday, so I want to say congrats on the retirement.
Thank you.
Any additional questions from CTV?
Yes, just one. Do we know if the people who died were vaccinated?
I don't have that information about those that passed away.
Okay, no problem. Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Yes, thank you. Just the one, you mentioned a couple of times now that Moderna is a little bit less predictable, not stable. Is that a concern for when you're scheduling second doses for those people who receive Moderna through the mass clinics?
Well, it is a real mathematical exercise, and we do have people that are tracking that. Actually, it's our Director of Corporate Services who is our accountant. And so we'll be, and you're right, we'll be making sure that we have that, the ability to provide the second doses when we're able to. And so, but that's all being tracked. There's an inventory management capability in COVAX, and everything that we receive is entered. So in the background work, I'm really simplifying it, but I don't mean to, but it's being tracked very carefully. And when we're able to, we started our planning for second doses, and we're looking at how that would get booked. But also, you're right, the big part of it will be having the actual vaccine to provide that. So I don't want to say that Moderna's less stable in the fact, I'm just saying the delivery of it is that we have learned that once it's once we see it, we receive it, we have it in our freezer, then we're certain that it's here. And all of these things are getting, we've come a long way. All of these little glitches do get ironed out at some point, but we have to be cautious because you're right, we have to give second doses, and all of that's being tracked. So I don't want people worrying about that.
Okay, thank you.
Any additional questions from the Windsor Star?
Yes, do you have any information to provide on the city offering 3 buses for transportation to and from vaccination sites and how that will work?
So right now we do know that Transit Windsor has offered that, And you just have to actually say that you're going to a vaccine, receiving your vaccine at one of the vaccination sites, and you would be able to have a free ride, based on the city's, generosity and support of getting people vaccinated. So that has been going on for a little while now. The days are going by, but probably for longer than a little while. And you can go on the city's website for Transit Windsor and have the schedule, and it's just a matter of letting them know that you're going to receive a vaccine. And if there's anything further, I'll let you know tomorrow, but I believe that's as easy as it is, that it's accessible for those that are going for a vaccine and round trip, there and back.
Okay, thank you.
Thank you, everyone. Have a good day.